We've been talking about other viruses going up, showing up a little bit earlier than normal. Why is that?
Yeah, this makes sense. So, as of late, a lot of us have taken off our masks. We haven't been socially distancing. And the same thing that prevents COVID-19 from transmitting person to person works for these other viruses. So, viruses like RSV and parainfluenza, the common cold, they're making a bit of a comeback this summer because we're close together. We're not wearing masks.
Does that mean that they're stronger than they would be, or it just means that they have, come at a different time this year?
Yeah, no, it's kind of the same strength as we've seen in the past. Some folks get, a runny nose. Maybe they're out for a few days. Some kids can get a little bit sicker, especially from RSV, those, very young infants. But, a little bit of an unusual time to see it, but not unexpected given what's going on. So just kind of the fallout from taking our masks off and getting close together, this kind of stuff will start to happen again.
And speaking of respiratory illnesses, I mean, I know this has been a conversation almost in every article that I read in children and younger adults. What can parents do, or what should they be aware of when talking about respiratory illnesses?
Yeah, I think for parents kind of interested in respiratory illnesses, it'll sound kind of like a broken record. So things you can do is ensure good hand hygiene with your kids. Oftentimes they can infect themselves by touching something, touching someone else, touching their face, cover those coughs, cover those sneezes. And certainly if your child is displaying symptoms, runny nose, cough, fever, don't send them to daycare, don't send them to school. That's just a recipe to make other kids sick.
And I want to get your opinion here on the latest on those rare side effects. For example, the heart inflammation that we've been seeing pop up. What is the latest on that so that people know in case they do go to get the second vaccine? As we know, some people are opting out of that second dose as well.
Yeah, I think this is important. So we've been able to get really good resolution into really rare side effects that are associated with these vaccines. With Johnson & Johnson, we have the blood clotting issue, which is rare, 8 cases out of, I think, almost 9 million doses. The heart inflammation is something we see in younger folks with the Pfizer and Moderna vaccine. But again, very, very rare, only about 20 cases per 1 million doses of the vaccine. Now, to contrast, if you took 1 million people and gave them COVID-19, 18,000 of them would die. So still really important to get our kids vaccinated, get those second doses. The likelihood of these things happening to you is very, very rare.
And I just want to reiterate that. So you're saying that treating heart inflammation or dealing with that might be better than dealing with the actual side effects or actually having COVID-19.
Absolutely. For a lot of these things, there's therapies that we can do to fix them. But I think the big thing is realizing just how rare these things are. They're just not common at all. It's pretty amazing that we're actually able to identify them versus, dealing with a COVID-19 infection. The mortality rate for that right now in the U.S. is about 1.8%, which is much higher than any of these side effects that we're seeing that are severe with the vaccines.
All right, Dr. Potthoff, thank you so much for giving us your insight and joining us today. We appreciate it.